Considering a hair transplant? Had one before? Are you a hair transplant professional? HairTransplantSociety.com is for you. We're connecting patients with each other to share experiences, connecting patients with clinics and doctors, and connecting clinics with employees. Join today.
Okay, so when we do that MaxHarvest hair transplant procedure, we harvest as far as we can get from the one side and then go all the way to the other side. So you're looking at the suture line with me, and let's show you where it is. Okay, so started right here. This is the starting point. Now you can see this. That's actually the suture line. So, right? Yep, here it is. Okay. So, okay, that's a good thing when I can't find my own suture line. Okay, this is it right here. This tiny trace line, you can see this how it goes into this little white area. That's the suture line. Let's follow it all the way around. That's the suture line right there. Okay, so let's just show the camera the entire way around. Vito, this came out absolutely perfect. I mean, literally, look at that. Okay, so see this little tiny white line here? That little line right there? That's the suture line right there. And for patients who are concerned about suture lines, this is how a proper suture line should come out if you follow your instructions and it's done with the proper hands. So you can see how undetectable that is. We have a website full of suture lines to show patients that are concerned about suture lines. So you can refer to as many suture lines as you want on our website under the suture line page. And here's just another great example of a patient that was a great patient, took great care of everything. That's why he got this undetectable suture line.
Don't see any detectability, any scar through the hair. He has a none or undetectable scar. You could wear your hair probably as low as 1/4 inch or less and no one would ever see it. Try to find it. Let's see if we can find it. Do everything we can to find this scar. That would be it right there. That's it. And that would be indistinguishable from if we made a crease in the hair right here and showed you the same thing. There's no difference between that and that.
I'm having a hard time finding the suture line in here. I think that's it right there. So you can see that, actually it's very hard to see, but there's very, very light indication of anything. And back here, it really kind of goes away. It's an incredible job on the suture line.
Suture line healed up, so if you want to come up here, you can kind of see when we do that MaxHarvest hair transplant, we'll start as far as we can get from the one side. This is the beginning of Jeff's suture line, which healed really nice. So let's take a look at that. You can see this little fine trace white line. I'm going to put my comb right over the top of where the suture line is. And that's the suture line right there. Now if Jeff were to shave this down with the 2-blade, you still won't be able to see that. So a crease in the hair right above it. Okay, let's just find a regular crease in that hair. Okay, so this is a crease in the hair. Okay, that's a crease in the hair. And then this is our suture line. So, once again, let's show the crease in the hair, and then there's the suture line. So, no different than a regular crease in the hair, and that goes all the way around to the other side. Now up close, but if you just look at this, see that little trace line? That's your suture line. Yeah, you can't even see it. And that's only at 4 months keeping line, so that'll continue to heal. And then you can see it over here on this side, that little line there. Yeah. That's the suture line. Okay. Oh, there you go. There's a good one. You can see that. See that guy up top there? Yeah. That's the suture line right there. So you healed perfect. On the money. Show the suture line. When we do a max size case, we harvest all the way from one side all the way to the other. So let me show you the suture line. Okay, there's the suture line. This is Aldo's suture line right here. So you can see this little line here. This line is where we got the hair from. So that's the suture line right there. And as you can see, if you don't do that, you won't be able to see that. There it is. There's no reason to get a follicular extraction, get less hair, spend more money to get a result like that. It's just not necessary. Here it is again. That's that line. I'm going to show you the entire way across. Right there. That's the suture line. And that's how we were able to take this gentleman and get him to that in one procedure 3 months later.